Hello, my name is Lacey. I'm going to be your nurse for today. Is it okay if we go ahead and perform the newborn assessment with you? Okay, perfect. Would you mind confirming the baby's name and date of birth? Awesome. I'm going to go ahead and wash my hands and give privacy. Okay, and I see here on my chart that it says the baby is from a vaginal delivery. Okay, perfect. So first we're going to start by taking the baby's vital signs. So first we're going to go ahead and take the baby's pulse from their apical pulse for a full minute. And it is 150 beats per minute, which is normal. And next we're going to do the axillary temperature through the armpit. And it's a 98.5, which is also normal. And we're also going to count respirations for a full minute as well. Okay, and now we're going to measure the baby's head circumference from the eyebrow line. Normal measurement. And now we're going to measure the baby's chest circumference from the nipple line. Okay, also normal with the normal limits. And it looks like, so now we're going to move on to the body itself. So the baby's body is aligned and it is symmetrical. Muscle tone is not diminished or decreased, so that looks good there. The baby is in a flexed position. Okay, and the baby did have a vigorous cry earlier, so there's no respiratory issues or anything like that, no respiratory complications. Okay, so we're gonna next we're gonna move on to the skin assessment. So what we have here, I noticed that there is vernix caseosa, which is a white, creamy material within the folds of the baby, which is normal after birth. There's also milia on the bridge of the nose, and there's lanugo on the tops of the arms and on the back of the baby as well. And on the back of the arms. There are a couple of red splotches. Those are known as erythema toxicum. And additionally, there are a couple purple spots, almost like little bruises, which are called Mongolian spots, which are also normal as well. Okay. Okay. There are no concerning red spots, no concerning bruises or discolorations or anything like that, or petechiae on the skin. The overall appearance does look good, does look pretty uniform, and there's also no clubbing of the feet. The feet are good. Okay, so the APGAR score we're actually going to give this baby is a solid 10, which is perfect basically for a newborn. Now we're going to move on to assessment of the baby's head. So it looks like the anterior fontanelle is diamond shaped, and the posterior fontanelle is a little bit triangular, which is normal, of course. I'm checking for signs of molding, which can occur after a vaginal delivery from, squeezing through the pelvis and everything. Again, normal. There's no cephalohematoma, which is a collection of blood or bruising on the head, and no caput succedaneous, which is swelling over the head that can be present after birth. But there's none of that, so looking pretty good. Okay, and now we're going to move on to specifically the facial assessment. So the baby's face does look symmetrical. Right now I'm going to go ahead and observe the iris of the eye, see what color we have. Looking for a light brown color in this baby. Yep, that's what we have. We also just assessed the PERLA, so the pupillary resistance and response to light is good. The pupils are, like I said, the pupils are reactive and responsive. There is a slight sluggishness, but that's normal right after birth. And the conjunctiva is clear and pink. And there is a slight strabismus present, which is also normal as well. Now that we've done the face, we're going to move on to the ears, nose, and mouth. So the ears are well formed and aligned. The nose is symmetrical and patent bilaterally. Now I'm checking the baby's mouth. I'm gonna place a gloved finger in the mouth, checking for like a cleft palate. Okay, I'm also gonna see if they exhibit a sucking reflex. Okay, the mouth appears normal with no abnormalities. There are also no Epstein pearls present as well. Next, we're gonna go with the baby's reflexes and the neck. So I just assessed the baby's swallowing and sucking reflexes, which are present. Moving to the neck itself, I'm observing that the clavicles are aligned and there are no abnormalities in the clavicles. Okay. So next we're gonna go ahead and continue with the chest assessment of the baby. Right now I'm going to, so the chest is symmetrical. Breathing is normal for the baby. Nipples are present. They're not engorged or anything like that. Breathing sounds are also clear. Did listen to those earlier. And I also did, like I said before, check the apical heart rate, which was assessed earlier through the vital signs, and there were no murmurs present. Even though if there were slight murmur, that would be normal because this is a newborn baby. Okay, so now I'm going to go into examining the umbilical cord. Okay, so I can see 2 arteries and 1 vein, which is normal. That's basically what you want to see in a newborn baby. There's no discharge or drainage from this umbilical cord. And I'm also going to go ahead and auscultate for bowel sounds. Bowel sounds can typically be heard a couple hours after delivery of a newborn baby. Bowel sounds are present. Okay. You're doing great. Okay, and now another way that I can assess bowel patterns and urinage bladder patterns is asking either of the parents about the amount of diapers that have been used. So I would go ahead and ask a parent, has your baby been voiding, either urinating or, pooping in their diaper, how many diapers, etc. Okay. So next we're gonna go into the genital assessment. So since this is a female, basically I'm ensuring that there's no discharge or any abnormalities, which there's not here. And I'm also making sure that the labia does cover the clitoris properly, which it does, so we're good there. If this were a male, what I would be assessing for is to make sure that the meatus is in the middle of the penis. I would be locating the testes, and I would also be locating the rugae on the scrotum, making sure that that's present. And again, like I said, this is also where we assess the voiding patterns by asking about the diaper count, things like that. Okay, now we're gonna go ahead and move on to the extremities, the arms and the legs of this baby. So everything does appear to be symmetrical, and muscle tone is within normal limits. Baby's moving around just fine. Range of motion is checked to be normal. Yep, the baby looks normal here. Definitely a good range of motion for this baby. Go ahead and count the fingers and the toes. 5 on this hand, 5 on this, 5 and 5. So all 10 fingers and all 10 toes are present, so that's good there. Now I'm examining the feet and the hips of the baby. Like I said before, there's no clubbing of the feet, and it doesn't seem like there's any distortion or dislocation of the hips. The baby seems fine here, and he seems healthy. Okay, so now we're gonna go to the spine and the anus of the baby. The vertebral column is aligned, and I'm not observing any openings of this baby. And with the anus, the hole is present, so the anus is present and patent. Okay, and now we're going to move on to the reflexes of the baby. So first we're going to be assessing the Moro reflex. So basically, as I drop the arms, the baby has a startle reflex. So that is good. Next is the palmar reflex. So when I basically touch my fingers to the palm of the baby's hand, the baby grasps my finger. So that is present. And then there's the plantar reflex, which is kind of the same thing, but just with the feet to the toes. Okay. We have already, I've already assessed the suckling and the swallowing reflexes earlier through the baby eating from the mother, as well as when I put my gloved finger in the baby's mouth as well. So those have been observed and they are present. And next we have the Babinski reflex. So basically what I'm gonna do here is I'm going to tickle the baby's foot and see how the baby responds. So as I tickle the baby's foot, it basically like spreads its toes out, brings its big toe up and spreads its toes out on both feet, so that reflex is present. And next we're going to do the Gallant reflex. Basically what that is as I stroke the infant's side of the spine, the baby is basically going to be like kind of twitching over to that side, kind of like a dance. So as I stroke the right side, it twitches over to the right, and as I stroke the left side, it twitches over to the left. Okay, so there's that. And then the baby, there is the stepping reflex. So basically what I do is I hold the baby up to kind of make it walk. Basically, just hold the baby up and then it walks. So that's present as well. And then lastly, we have the tonic neck reflex. So, and that has been assessed earlier when we did the neck, and that's present as well. And I believe that will conclude our newborn assessment. The baby has had a quietly alert attitude throughout this process. Been a very easy baby to work with. And so I'm gonna go ahead and give the baby back to her mother. And like I said, this completes the newborn assessment. So here's your call bell if you need anything. Feel free to reach out and I'll be happy to help. Thank you.